Delighted to say I've been joined by Dwayne Johnson, the Strategic Director for Communities for Halton Borough Council. Good morning, Dwayne. How are you, sir?
I'm really well, thank you.
Thank you for joining us at the launch of Healthwatch Halton. How do you envisage Halton Borough Council working alongside Healthwatch Halton?
Well, I think that Healthwatch has got a really important role for us. I think in terms of scrutinising adult social care and the National Health Services, in terms of looking at the quality of some of those services and the way that those services are run. But I also think that they're there for to represent the patient, and that's really important for us when we're formulating our strategic planning, but also identifying some of our key priorities as we go forward towards the integration agenda between the National Health Services and adult social care.
Yeah. So it'll be a relationship that benefits both parties.
Oh, absolutely. It's got to influence it. As I say, it's a patient's voice. Yeah. Really critical to us.
Fantastic. Thank you very much for joining us today. I hope you enjoyed the event.
Yes, thank you.
Okay, I'm delighted to say we've been joined by Helena Dennett, the Compliance Manager for the Care Quality Commission. Good morning, Helena. How are you?
Good morning, Matthew. I'm very well, thank
Excellent.
you.
Thank you for joining us here at the launch of Healthwatch Halton. How do you see the Care Quality Commission working alongside Healthwatch Halton?
Well, the Care Quality Commission is very committed with working with local Health Watch. Working with Healthwatch Halton is one of the main ways that we can better hear the voices of people who use the services.
Okay.
This information will help us spot good care, but it will also help us spot where care is poor and where we may need to take action in order to improve your local services.
Okay.
The information will also be used when we plan and when we carry out inspections. And this can also help us better protect people who are detained under the Mental Health Act. We would ask that if anybody wishes to share their experiences, to please contact their local Health Watch. However, if you wish to contact us directly, please ring 03000 616161, or you can visit our website on www.cqc.org.uk.
That's wonderful. Helena, thank you so much for joining us. I hope you enjoyed today's event.
Thank you very much.
Right, delighted to say I've been joined by Derek Twigg, the MP for Halton. Thank you very much for joining us today. How are you?
Very well, thank you. Back in the constituency on a Friday, as always.
And on a beautiful sunny day as well.
It is. I'm looking forward to a nice weekend.
The weather's always this glorious in Halton, of course. Now, we're here at the launch of Healthwatch Halton. How do you envisage working alongside Healthwatch Halton?
Well, like any other Member of Parliament, a large part of my work revolves around the healthcare and health services. Sometimes it's complaints, sometimes it's issues about resources. So it's a very important part of my work. So I'll be working very closely with Healthwatch, and I'm sure that we can both work in partnership, like I do with the local hospitals and now the Clinical Care Commissioning Group and local healthcare providers. So I imagine the same sort of relationship, and we'll be able to help each other ensure we get the best for patients and improve health services to the extent we want to see them improved.
And anything that gives a voice to local residents and local patients, as you said, can't be a bad thing.
No. National health and healthcare and care generally is so important to anybody, but particularly here in Halton. And yes, a voice that will add to the, I think, various people that can actually help influence healthcare.
Wonderful. Hope you enjoyed the event today. Thank you for taking the time to speak to us.
Thank you very much.
Okay, I've been joined by Clare Duggan from NHS England. Clare, thank you so much for taking the time to join us. How are you today?
Very well, thank you.
Excellent. We're here at the launch of Healthwatch Halton. How do you envisage NHS England working alongside Healthwatch Halton?
Well, I think for NHS England in Merseyside, we've already started working with Halton Healthwatch. They attend the quality surveillance group that we have on a monthly basis. So we've already started that partnership working and to ensure that we hear and listen to the voice of the community of Halton. And we're looking forward to developing that relationship much further so we can really improve the quality of the services for the local population.
Fantastic, that's brilliant. Thank you for involving us already. That's wonderful. I really hope you enjoyed today's event.
Thank you very much, thank you.
I'm delighted to say I've been joined by Dr. Cliff Richards, the Chair of Halton Clinical Commissioning Group. How are you today, sir?
I'm very well, thank you. I'm very glad to be here with you today.
Well, thank you for joining us at the launch of Healthwatch Halton. How do you envisage Healthwatch Halton working alongside the Clinical Commissioning Group?
I think the way you phrase the question is inherent in the answer. It is about both organisations working alongside. My understanding of the duties of Halton Healthwatch is in some ways to hold the health planning authorities, the CCGs and others, to hold them to account.
Yeah.
I think that's absolutely important, and I think the CCGs are entirely appropriate to be held to account, but I think that should be, I would want, in a much more a partnership arrangement where we're both achieving our dual goals.
Yes.
With absolute confidence in each other, with good communications and feeling that we're on the same track.
Definitely a relationship that helps both organisations.
Absolutely.
Fantastic. I really hope you enjoyed today's event. Thanks for taking the time to speak to us.
Okay.